I don't need to tell you, a slate of new weight loss drugs has taken this nation by storm in recent months. Ozempic, Wegovy, they've become household names. And now there's Zepbound added to the mix. A new head-to-head trial shows people on Zepbound lost more weight than those taking Wegovy. Now, this study was funded by Eli Lilly, the maker of Zepbound. It has not yet been peer-reviewed, but some doctors say the numbers for both medications, frankly, are astounding. Let's get more details from NBC News medical contributor Dr. Vin Gupta. Dr. Gupta, good to see you as always. Walk us through the findings here.
Yeah, Anna, this is one in a series of findings suggesting that Zepbound is just more effective than Wegovy when it comes to weight loss. And you just put up the stats. It's pretty incredible. 20% weight loss, body weight reduction with Zepbound after a period of time versus 13%. And we think it's because Zepbound is a combination drug. It actually makes us feel fuller, just like Wegovy, but it also helps us more effectively metabolize fats and sugars. So it has two mechanisms of action versus just one. And this is, again, proof positive that maybe there is a difference here in efficacy.
So you mentioned how they slightly differ, but they're both GLP-1s, right?
So Zepbound is a GLP-1 plus a GIP agonist. I know that's sort of medical mumbo jumbo, but it basically has multiple mechanisms of action within the body. Wegovy is just a GLP. And so that's the difference here, is that Zepbound does a lot of different things in the body to help us essentially manage our fat intake and also manage how much we're eating and not eating.
What about side effects? Is one more concerning than the other?
Same thing. So, GI intolerance is really the big one. So there's actually, in early days, there was a 50% drop off, Anna, between dose 1 and dose 2. Those GI side effects were pretty significant. People said, you know what, I'm not going to go to dose 2 and continue on. That has now been mitigated. We're able to walk people through. And now really the big unknown is, how long do you need to be on these medications in the first place? That is the big unknown. Is it years? Can we actually wean people off? We don't know. And oh, by the way, is Medicare and Medicaid going to cover these meds as we enter into the Trump years? This is something the Biden administration has said that they will want to do, but that decision will be up to the next administration.
Right.
So access affordability is a big problem.
And so can people at this point be choosy? I know that supply demand was an issue earlier on. Also, I think a lot of folks looking at this say, I want to take the one that's going to help me lose the most weight.
This is a critical conversation to have with your medical provider, because losing 13% of your body fat is still a big deal, and it's still a remarkable feat. And we have to be thinking about what our goals are here. I worry sometimes about overuse. We've seen some reports of that. So what is the goal of therapy if your provider decides to start you on this? How long should you be on it? And yes, if you're a non-responder for whatever reason to Wegovy, could we class switch you to something like Zepbound? Potentially. So there is an option here. If something isn't working for one patient, maybe we try something different here. In this case, if Wegovy's not working, perhaps we try Zepbound. There's going to be oral alternatives soon, though, and I'm excited about that, because that's going to lower the price of these medications. More people can get access to them, and that's a good thing, because we're seeing so many. How many times have you and I talked about this? It's not just weight loss. It's helping to reverse type 2 diabetes. It's
heart health,
addiction disorders, potentially actually allowing people to get use substances far less. So there's a lot of different impacts on human health. And so hopefully as we get cheaper alternatives, more people can benefit.
This is fascinating. Let's keep the conversation going. Thank you so much for bringing us this new information. And